Right, welcome everybody. My name is Edward Shin. I am the CEO, co-founder of Quality Reviews, otherwise known as Q Reviews, and we are a real-time digital health engagement company that helps patients and providers navigate the care journey through notifications and alerts. As mentioned, I'm based in the East Bay of San Francisco, and I wanted to really welcome enthusiastically our three panelists as we talk about the digital front door and access in healthcare today. So kicking it off is Kate Newbold. She is the Director of Digital Design and Customer Experience at Beacon Health System that's based in South Bend, Indiana. Welcome, Kate.
Thank you.
We've got Dr. Abe Warshaw, who is Senior Vice President and Chief Medical Officer at Live On New York, the transplant organization for the Northeast region in New York City. And Abe is also the former Chief of Access Services at Mount Sinai Health System in New York City as well. So welcome, Abe. And Rich Clough is Senior Manager at ECG Management Consultants. Rich comes to us from a career in management consulting, specifically in healthcare, and most notably at the advisory board and now at ECG. So welcome, Rich. So let's just kick it off. Let's just dive right into it. I'm just going to open this up to anybody who wants to take it, but what is your definition of patient access? And I'll just, as a toss-up. And I'll then point it to Kate.
Yeah.
And then we'll go around.
Yeah, absolutely. Great to be here. Thanks for having me. You know, patient access is something that we think about every day on our team. So very, very near and dear to our heart. And we define it simply as, you know, how easy is it to do business with Beacon? At Beacon Health System, we're a regional provider in the Northern Indiana, Southern Michigan area, 5-hospital system. We serve, a large cross section of patients across our different region, and continuously we're always trying to look for ways that patients can engage with us and access our services while trying to do as minimal legwork and footwork as possible, right? Sometimes in healthcare, we are our own worst enemies when it comes to ways that patients want to engage with us and want to access services. So for us, it's really about how do we create that environment that makes it easy to engage with us through whatever channel they want to, right? Through Google search, through our website, through patient portals, through phone calls, through text, through email, whatever they want to do. How are we making those pathways as easy and seamless as possible so that they can then, make an appointment, which is one of our key metrics for how we are measuring success. And then how, once they step on foot onto our facilities, are they actually getting to that care appointment? And how easy is it for them to really engage with their practitioners and not have to worry about all of the incidentals that come around it? We really want everyone to be able to practice top of license. So we try as much as possible to facilitate all those other aspects of access so that we're easy to do business with and they can engage with their caregivers as appropriate.
Nice. Abe, what does patient access mean to you?
Well, certainly, I could not agree more that once patients are in the system, make it easy and reduce the friction. On the clinical side, the first thing I always think of when you think of getting the patient to the right place and at the right time is really making sure first that clinically they're going to get at very least the level of care that they need. I mean, we're all about wanting not to send a patient who's not that sick to an ER and getting a patient or getting an ambulance to a patient if they're really sick. But I think the key really, the first thing I do think of is for access is the right place clinically. And if you have to make a decision between, then you have to err on the side of getting the patient to a higher level of care. But the key is, of course, avoiding that whenever possible. And then once you've gotten that patient to the right place in terms of the level of acuity, then of course you try to get them to the most convenient place, a place that matches their finances and is easy for them to navigate. And the other part of it, taking it past even that great visit that they have, is whatever follow-up they need, make sure that is seamless, that the provider who gave them great care is not then struggling to find that specialist